I don't think that you can use the movements of free shape for any work. The idea is very good. The idea to combine several options in one device is very good. I like it. Maybe it will be for the future, for example, you to have a different probe that you can put on, and for example, some additional tools that you can also adjust and do this. But I don't
scan from the outside,
yes.
more accurate. Like your device.
Actually, with this software, I will show you. Because with this software, you can do the 3D scan of the face with simple photography. Because we don't have a camera here, I didn't show it yesterday. I will show you on the presentation how we can do that. I don't use it that often because actually I don't think that I need it. But
I think with the stickers in the
yeah, we have stickers.
Yeah,
I have it with me.
Yeah.
Yeah, I have these stickers, and Panayotis could have these stickers when he will sell it with a device. The stickers are going with it. It just, I have micro lens, and for me, I couldn't do it with the camera I use professionally, and I had to bring the camera from my house, which I didn't use for many years, with normal lens. And for me, it's hard to do these 13 pictures of the patient all around, because I do professional photos. I'm a professional for my work, and this is additional time. I don't like 3D scan views, at least in my point of view, it's not the best. Guys who invented it use it all the time, but they're not making photos of the patient in classic dental way. So they're doing only this. And if you're working with Smile Creator and Exocad, that makes sense. Why? If the 3D scan is done properly, you can put the scanned models inside this face without too much distortion. Because sometimes you have a picture of the face, you're trying to adapt the scan, and they look like too stretched or too narrow. So it's not reality what you're seeing, it's something that is, the software try to adapt a 3D object with a 2D object. And maybe for those who work with Smile Creator, that makes sense. But in my practice, I just didn't find a lot of meaning to that. Yeah, marketing tool is great because the patient, oh, is it my face? Wow, so awful. There, you can do that, no problem. Like, I'll show, because I'm not, maybe, still, my camera is not the best for it, like, that's what you can get. Not the best. Or Alex Laurel. Here I was thinking that it's very important, but Eugene also told me that it's bad. This is a patient with dentures, so. Okay, that's what you can do in the software as well. And you can export it to the dental technician to Exocad to any software if you need to. And you don't need to buy additional equipment.
Only the stickers.
Usually they're free of charge.
Yes, this is right.
But I don't know about Panayotis, he might charge for it. Well, this is 15,000 euros, stickers 20,000 euros.
Yes.
So we are going to our patient. You see, we come into the place we left off. So right now, you see what I did here. Look, this is the trajectory of opening. This is the way he opens. And look what happens. He closes in different trajectory. So I'm trying to see what happens here. And let's see, would it be any contacts? This is the first contact. Look, remember I was telling you about the canine. And look what happens here. Panayotis is closing his mouth in different position. Maybe his starting position was different. Maybe that's why he was coming back to the canine. Let's see what happens after this canine. So the canine is the first tooth in contact when Panayotis is closing his mouth. Okay, good information to know. Let's see guided movements right now, because what we need guided for, yesterday I didn't tell you, we need guided movements for occlusion analysis to see if there are interferences, premature contacts, anything that displaces the jaw during the movement. So we don't use guided for our future work. We will not relate to the guided movements for settings, for trajectories, never. For trajectories we can use the first movements that we did, because the first movements are the most correct movements. Or we can use free movements, but never guided. Okay, let's see what happens with Panayotis when he's guiding. And here it's better for me at least, I watch the contacts here. So let's look. And let's try to see what we are looking at. So first it was protrusion, remember? Look, you see? Sorry. So you see here? This is his cusp that is hanging. He's coming back, then it will be to the left side or to the right, I don't remember where he was going. Right side, okay. No contacts here, good. Left side. You see? You see here? This is bad. This is a contact on a non-working side. This is bad. And actually, do you see this tooth is intact? That's what usually happens. Okay, that's good information. Let's check it again on another guided movement. Because that case, we'll know that if we do just implant on the crown, a crown and implant on the lower side, we have to grind the upper molar. Or we have to do something about upper molar. So right now it's not the lower molar that concerns me, that is a little bit inclined. Right now it's the upper molar that is overacted. That concerns me more, because this tooth in movement interferes with the lower molar. Okay, let's do another guided movement. Oh, actually, this is not very correct. When it's too much red, I think that Panayotis was biting too hard from the initial side. This is not very good test to trust it. Because look here, when you see too much red, you better discard this test. Or you have to repeat it if you have models before. But we'll see, let's see, why not? Actually, no, it's in the end, it's okay, it's in the end. Let's see what happens here. Is it the same pattern or not? So he's going to protrusion. Is he going to protrusion? Yeah, finally. Look, you see? Again. Then this premolar here. So then he's going to the right lateral protrusion. Actually, the canine is not behaving very bad here. You see, on the right side, no problem. That's why he is so easily moving to the right side. No problem, no interferences, no premature contacts. Let's see what happens on the left side.